Mary Jo Perry.
I'm here, Joe. Cindy Sir, how are you?
Nice to meet you finally, yeah.
How are you? And what do you do?
Is that
What do you do?
Brand new D. Yeah.
Cindy, this is Madeline Fowler. She used to be the CEO at the hospital meetings. Yes. I wish she'd give you some insight. She's not lost.
It's lovely to meet you. Thank you for coming.
Health food. Come in, get into it, boy. Health food. We'll try some of that.
You need to meet her. I'm good.
Hey.
Cookies, some coffee.
Oh, coffee sounds good.
That's my middle.
Dear Mark, would you do me a favor and give me your and then there's mine right there, my email, but if you give that, I'll make sure I connect
I'll
with you.
keep you out.
And your little front running woman here. There's two we can have great ones.
Yeah.
She and I used to live together. And then she
I know the cutter.
That whole health thing,
Yeah, I know. Well, everything. I mean, we're so tough.
All right.
Very
Yeah, you should.
But what's the other way?
They've always made. Yeah.
Where do you want to set?
Pretty minimal
Where are
effort.
you?
Wherever.
That's always the challenge.
Yeah.
So people can,
Do you
How's that?
have a lot of people you have to turn away?
Well, yeah, we do turn a lot away.
Mrs. Barrow.
We have some that,
Hi, Mrs. Barrow.
you know,
Hi.
2 or 3 times.
Never seen it in years because I know I didn't all the time.
How are you doing?
You mean your health, John's?
I heard you went to, and how are they doing?
Yeah.
Because, I mean,
Yeah, that's what I figured.
They both still alive. Oh, yeah, my dad's 91 and they still alive. They're still over there. Yeah, they're still working, still in the house, still doing what they do, so. I was talking the other day, I live in still. I didn't realize you guys were that. Cookie?
Let's start the floor. Mic check.
I thought he was calling dust.
How was? You'd be amazed. I'm here. All right. Hello.
how are you?
Good.
Hey, welcome everybody. Thank you for coming. Lonnie Turner, just glad that everybody came out to talk to our new administration. Cindy Sturger, you just met her. A lot of you did. Larry Putnam just came in. Interim CEOs. Larry's got the hospital. Cindy's got the health center. I brought the cookies. So there we go.
and got the door unlocked.
I don't know. Don Bauer got it for us. Thank you.
Well, first of all, I've been able to visit with with some of you before we started. Thank you for coming out tonight. It's always nice to have time to visit with people from the community. We'd like to do it more. This is our first time to have an opportunity to visit with you and just open it up to questions. We're just going to take a few minutes to introduce ourselves, and then really the floor is yours, and we're going to be as forthright as we can be.
All right, sorry I was a few minutes late. I sat down at the apartment over there and the time got away from me. Finally got over here. Yeah, Cindy and I have been putting in long days. We certainly have. As interim CEOs, she on the clinic side, me on the hospital side. Well, I'm Larry. For those of you who have been here before and heard my spiel before, you're probably sick of it, Kirsten and some of the others, you know, that I'm an old Montanan, no hair left much, been hanging around healthcare for a long time. I spent 14 years up in Malta, Montana, if you know where Malta is. It's up on the Highline, little town, Class B 10, little bit bigger than Superior, but not too much. Up there for 14 years as the CEO at the hospital. Tried to retire 6 years ago. Very unsuccessful at that effort. This is my fifth, I keep saying sixth, maybe it just seems that way, you know. My fifth interim, temporary hospital assignment in the last 6 years. Superior is. I've done them in Jordan, Montana, Lovell, Wyoming, Big Timber, and Livingston, Montana, before I came here to Superior less than a month ago, just a month ago. We've been talking, in Alberton today, we talked about definitely being separate organizations. The clinic is very definitely separate from the hospital, but yet we work hand in glove together. Cindy and I meet every day. You can't have health care in a hospital without, primary care providers and primary care services, clinic services. So we do work hand in glove together, to move healthcare forward, certainly in the county. I guess with regards to the hospital side, certainly we have a really good crew here. I've been very impressed with the leadership team, the physicians, the mid-levels, the medical providers. Before I even accepted the assignment, I was comfortable with the medical staff and with the leadership team here and the employees. You have to have those things kind of all pulling together on the same page in order to be successful in healthcare, and you're real fortunate to have that here in Superior. And certainly the board has been a very positive experience in the 3.5 weeks that I've been around. The board is very committed to making sure healthcare stays in the community for a long time to come and moving it forward into the future. It's no secret we've certainly had some cash flow issues, some budget issues. We've been working very hard on those issues. It's just going to take some time, and really Cindy will talk about that in a minute here, but it does take a little bit of time to come in and look at and figure out what's going on with the operation and with the cash. And the bottom line kind of for me is we're hemorrhaging cash at a rate of about $50,000 a month. We have a payables balance of about $550,000 a month. And that was headed in the wrong direction. The last 3 weeks actually made a little progress. Today I just ran some numbers, and just in the last 3 weeks we paid that balance down a little bit, about $75,000. So, I think we're in the early stages of kind of unraveling the budget and the financial situations on both the hospital and the clinic, and we're just real excited to be here. I live in the apartment right over below Dr. Pafflin. He's up on top, and I'm down below in a little subterranean apartment down right across here from the from the ambulance barn. I'm not supposed to say that. Where's KT? Is she in here?
She's not.
Oh, right. I heard that. I've really not sat down and talked to her, but I'm not supposed to call it the ambulance barn. It's an ambulance facility. I'll remember to do that. But yeah. But every morning I try to get up. I try to get over here early. Cindy says I'm always earlier than she is, but it's not always the case. But when I do get up, and when I get over here, I step out of that apartment, and when it's light out, it's just absolutely incredible in Superior, Montana. For an old Montanan, to get up, it's a real privilege to be here, to get up and walk out that door and see those tamaracks on the other side of the road there. It's a pretty spectacular place, and be happy to answer questions, concerns that you might have, as we go through the meeting. Oh, Cindy.
I just want to recognize that the only reason both of us are here is that you had 2 boards of directors that did an outstanding job. As many of you know, either that were involved in it or read the newspapers, there was some leadership issues here, right, in the last year. And so your boards acted quicker than most boards would and took care of that issue quite quickly. As many of us know, there's probably a lot of incompetent leaders in the world, and some of them are still in leadership positions. And somehow, both of these boards were able to understand what was going on and to help take care of that in the best way that they could at the moment that they knew the information. And so there's two board members here, I just want to make sure that you know. John is on both of the boards, if you want to say hello.
I think everybody
Come on,
knows
say
me.
And Lloyd is on both of the boards.
And you
You're
get
on both
Jim.
of the boards? Right. On both of the boards, you want to say anything?
Anytime you'd like to talk, I'm available.
Sorry, we have Jim DeBree, I'm sorry, he was an original board member on the clinic side as well. And so I do want
He's
to,
on the current county.
in the hospital, right, we have dual, which is an unusual thing. Quite lovely to have, but it's an unusual thing to have board members that serve in two healthcare capacities. It's quite a statement to this community to do some of that, right? To have that collaboration.
I actually had that happen in Malta. When I was up in Malta, we had a separate board for our long-term care facility, our nursing home. We had 7-member boards on both sides, and 3 of those members crossed over.
Yeah, it's a great model. And then I do want to recognize, healthcare can't be delivered unless you have healthcare providers, right? And so we have 3 outstanding providers right here. Just want to recognize Dr. Pafford, who of course works in the clinic and of course works in the hospital, right? And Kirsten, who, as many of you know, no offense to Dr. Pafford, but nurses run healthcare. You need to know, as we all know, if we don't have good nurses. So Kirsten runs the nursing over at the hospital, and Regina runs it here. And I have to tell you, both of us have been around a lot of nursing staff. These 2 are exceptional. It's one of the reasons when I met Dr. Pafford, who also is a musician, which is one of the reasons I said I could come here, because I hadn't really met a classical guitarist doctor before, and Regina, who is so solid as a nurse. So there's just really good staff that work here. So we came here, and it really feels like we came and there was a bundle of everything was really wrapped up in lots of vines, and we couldn't even see what the bundle was. So we're here just starting our 4th week, and the whole 3.5 weeks we've been here is about unwrapping those vines, getting them cleared so we can see what is here. So we haven't even gotten to the place of saying what needs to happen. We have a sense, but we're not going to jump to that, right? You've just had that experience in this community, right? A lot of jumping around, a lot of decisions being made. People didn't really know everything going on, and we're not going to do that. We're really unraveling that, as Larry talked about, and taking a look, and we're getting pretty close with our boards of saying, this is the state of the state right now. Larry gave you some implication of what's happening at the hospital. We have a similar trend going on at the clinic. It's been turning in the last 3 weeks, okay? But we have to get clear before we can say what's the plan. And we're just starting to get clear. And so we're going to share with you and any questions you have about what we know at this moment in time. Lots of experts in this room. I've had the privilege of meeting some people that have been leaders in different facets here. So we're opening that up to you to ask us anything that you have on your mind or wonder about.
Fire away, fire away.
Are you getting the billing straightened out of from the clinic?
I am hoping to heaven I'm
I
getting
mean,
it
when
straightened out.
they are a year behind in billing,
So we are not anymore, just FYI, that is getting
and
straightened
then
out.
they bill you and you pay it, and then you still get another bill?
It's quite frightening, isn't it?
Yeah.
I'm with you, it's quite frightening. It's frightening.
I mean, how can you collect from Medicare or even our
You
supplements?
can't.
Some of them.
After a year, you
can't.
can't.
Right,
Right.
you can't.
So you've lost it?
We have lost some. I mean, just straight up, yes, we've lost some. But we just went through the amount we lost on the clinic side. Now remember, we are a very small clinic, okay? You know, you live really close to Missoula, right? There are some big clinics in Missoula. We're very small. We live in a small populated county. So for us, it might sound like a small amount of money,
Oh, it's big.
but the percentage, right? So we're quite concerned that stops. That was the first thing we did the first week, both of us.
Do you need to
Stopping
get
our billing.
another new billing? Yeah.
We will be, Just FYI, that's in the plan, that Lloyd on the Finance Committee has seen the first stage of a proposal, and our board's meeting Thursday to look at what might be the beginnings of a plan to make sure our billing stays up to standards that it should have been at.
And not being billed twice for the same.
Yes, so if you have been, I want to hear about that, and I would like your name and phone number so I can take care of that pronto.
What was the other one? With the thing. You've lost a lot of patients in Mineral County, a lot. They got so fed up with this, and I'm hearing it out in the public to my face, will never go back to this hospital. Never. You've lost them to Sanders County, and you've lost them to Missoula. How are you ever going to get the trust of the Mineral County residents again?
So,
You get doctors, and they fire them.
well, you know better than I do, right? Patient care is the #1 reason people come back. So what we have to do is give people an extremely positive, accessible, not double billing them bills experience. When that happens, people will come back. We have to change how we deliver care. We have to do it the right way, and we have to do it when people need it and give them what they need at a quality standard, right? So that's what we have to do. That's our mission.
I'm
That's what
talking
we're
of
supposed to be doing.
personal experiences. I've
Right.
had personal experiences in the emergency room and in the lab here. It's not even sanitary. Why don't you get to see MD or DO in the emergency room? All you get are PAs, and there are some I do not want.
So I would encourage you to make sure you talk to us individually about that, about your specific experience.
I
That
have.
sounds like you have.
I have.
Perfect.
How did
So I'm gonna let
we
Larry-
do on rectifying it, Shirley? How did we do?
I'm not good. You were excellent.
You will
But
not,
I'm not getting itemized bills, and there are errors.
well,
I
you,
am with you on billing. We are doing our darndest.
When will that come into play? When you
We're
get
doing it every day.
itemized
Every
billing?
day.
I go down here every 3 months to the hospital and to the clinic, every 3 months. I've had some bad experiences.
you know, back to the PA question, you will not get PAs, or excuse me, MDs and DOs in the ER. You will not get MDs in the ER in any community of this size in Montana. Terry and Ecolak and Circle and Sheridan, Montana, they run on PAs. They run the ERs on PAs, and they're just as qualified as MDs or DOs.
Some of them aren't here. They need to go back to
Some may,
school.
or, those are personal choice issues. They're personal choice issues, but you cannot afford in Superior, Montana to staff your ER with MDs all of the time. It's just,
But when
it's
you-
impossible.
When they
It
get
is
doctors
impossible.
here, why do they up and fire them? I mean,
So,
We can't answer those questions. We weren't here at the time.
I know you
this
were, but
occurred.
I mean, they can still practice in other places, but they're not allowed to practice here. I mean,
So Shirley, here's what I need to tell you about your boards of directors and the staff here. Their concern is to make sure that you're safe. So somehow those
Right.
boards and those staff learn something about these folks that they cannot make public. Because we live in America and we're a litigious society, right?
it's,
So every community I've worked in, and Larry has too, there are people who think exactly like you, that the doctor or the PA should not have been fired. And we don't know if you're right or wrong. All we can say is at that point in time, you have incredibly competent board members and staff that are still here that said they did not feel it was safe in the capacity at that moment for those people to be serving the context, which is this community. That's all we can say. And then we move forward and everyone tries to make a better decision, and you have every right to complain about it. Because when we lose a doctor we really like, it breaks our heart.
Right.
I mean, this one doctor has most of the patients from here.
Sure.
And if they, and he's still practicing, he has hospital, and the other one, I mean,
We feel your pain, and there's nothing we can do about it.
Yeah, I will say that the community, I've seen some other examples of this, that in other communities, these situations with physicians that have gone, come and gone, and they're beloved in the community, and they're not there, anymore.
They're next door.
Well, but they're not
No,
practicing
no.
at the hospital, they're not at the hospital or the clinic. But the community will hang on to that for, up in Malta, there were a couple of situations like that went back to the 1950s, okay? You gotta let it go. And if you don't let it go, you won't have a hospital and a clinic. And that was our message this afternoon in Alberton. It's really important right now because of the cash flow situation and the issues that we're having. Maybe you don't like the ER and you don't like that service, or you don't like the primary care situation or something, but please come and use the long-term care facility and the assisted living facility and those facilities. And the clinics, I mean, don't get me wrong. Use our facilities because that's really important to us right now. It's just really important to us right now. One or two patients in the long-term care side or the assisted living side. We had an admission over the weekend in the assisted living, which was really nice to see. That's a beautiful facility. It's very well run. You get much better service with the long-term care facility and the assisted living facility than you're going to get in Missoula or Plains or anywhere else. I mean, it is a very caring, personalized service. And also the surgery services that we're cranking up with Dr. McClellan. He's a real class guy and excellent physician, very high quality. Also Dr. Gardner, we're working with him. John has been working with Dr. Gardner. We're in the
Now, what is
process.
Dr. Gardner?
Gardner is a general surgeon who semi-retired over in Polson. Very excited about coming here. We're hoping to get him in December. But sometimes, even in these tight cash flow situations, you have to invest a little money in those surgeons, although we don't have to invest too much. The equipment is already there. The foundation board bought an operating microscope for Dr. McClellan.
And when we had surgery here, a previous doctor, that was part of your revenue. Now there's...
Well, there's some,
How
but we
much?
need more. And we need the community, especially young couples and kids, my grandkids' age, with Dr. McClellan. I mean, ear tubes and tonsillectomies, and he's very good at those sorts of things. That's kind of a bread and butter kind of thing with surgeons.
As long
with
as I'm
ENTs.
being naughty, do you think that we're a little bit too top-heavy? I mean, we've got more than we ever had. And
Well, we talked about that.
administrators to the administrators, and I'm going, where does all this money come from to pay for all these people?
Very, very, point well taken, point well taken.
$2,100,000 in debt, mortgages.
I'm not sure of the numbers, that's
Oh, yeah.
something we haven't, I've not heard that number, but,
The mortgages are on file, recorded in the clerk and recorder's office, and anyone has access to them. The first one was
Sure.
over $1 million, and the second one, not too long ago, was $600,000. So that's over $2 million. What
In debt. Is that what
In
you're
debt.
talking about?
And who's gonna have to end up paying for that?
Shirley, and I don't know the number either, but the documents that are recorded are gonna show you the amount that it was owed at the time they were recorded.
Right.
The first one, and the 600,000 is relatively new.
Right.
The first one is substantially older and has probably been paid down quite a bit from the time it was recorded. They don't change it every time there's a payment made.
No, I know that. I mean, I worked in the clerk and recorder's office. I recorded those.
Yeah.
And what is the interest rate on those? And what are your payments a
And
month?
I
Are
don't
you,
have the answer to that, as I said.
what are your payments a month? Are you making them?
oh, yes, oh, yes.
And
We're making all of
Shirley,
it.
we appreciate you bringing that up, and we'll look at that from your perspective and try to get back to you on that. because that's
Back to
good
your other
information.
point, which I think is very well taken. I mean, we are, this process that Cindy and I are talking about, we're going through our organization anyway, and I think Cindy's doing the same, but we're going through, the only way to solve a budget or cash flow problem, there's only two ways. You increase revenue, come and use our surgery, come and use our long-term care, come and use our primary care.
That's
That helps
revenue.
us. That's the best thing you can do for us right now, is to use our services. The other way is to reduce your costs. I mean, that's the only way to solve the cash flow problem. And we are going through 12 hours a day with our teams, going through line by line every contract expense, every supply expense, every people expense, every position. And we will have those plans in place. You got to give us a little more time. We're not quite there yet, as Cindy said, but we will have a plan to get this thing in balance and to pay down that debt and to pay down that cash flow issue that I'm talking about. I mean, we have to get there. I mean, it is a serious problem, and we will get there. But we're right in the middle of that
I did budgets
process.
for many, many, many years. I worked for the county for 40 years. I did budget, payroll, you name it.
We might be getting you on our board, Shirley. I have a question back here.
No!
I just have a question back here.
Well, I guess I'll
Would you like to
make
go,
a
or-
quick comment from
You bet.
what John was saying, that it is a moving target, how much you owe. you
Right.
know, And anywhere.
Exactly.
And in a service area like this, there might even be the opportunity for some debt grace. To me, that's a third possibility to increase cash flows. You can make some arguments here. And I'm not sure about billing for, I'm not going to talk about billing, except that across the country, we've had difficulties with billing, and we've had, whether it's in-house or out-of-house, may have been done properly, or maybe it started out properly, but then other people picked it up, and there may have been some loss of revenue that really the hospital could appeal and say, well, we're owed some of that. It went to the wrong pocket.
Possibility, yeah, possibility.
Yeah, we're looking at
On
everything.
the, I would say on the hospital side, it's a little bit different than the clinic. Deb Green, and for those of you who know who Deb is, Deb actually lives in Plains, but she's commuting back and forth every day. And she is just an absolute jewel with billing. I mean, she's an expert on Medicare and Medicaid billing and private insurance, and she has been working very, very hard to bring our receivables balance. That's the other picture with the cash flow. That's we were playing catch up until just the last couple of weeks. We've had some strong collections the last 3 weeks or so. Before that, even before that, but it's been particularly strong. And so that, the bills are going out on the hospital side. They are going out, and the cash is coming back in, maybe a little bit in advance of some of the issues that Cindy's been dealing with over in the clinic. And don't forget, I mean, I don't minimize this at all, but the bills on the clinic side are much smaller than the Medicare bills that we have on the inpatient side or the long-term care side. In most cases, the outpatient bills for lab and x-ray and those sorts of things are smaller as well. But some of the bills on the hospital side are some of the revenue. It comes in bigger chunks, so it's easier to get at it, to get it corrected and then turned around and back to us. So we're in the throes of all of that right now. And it is getting better. It's getting better. And Cindy is, I know, working very hard, certainly on clinics.
Another question I
Shirley,
have.
can I hold you just for 1 minute, because we had someone else? I just want to make sure we get everybody.
Okay, I just have a quick question. You're talking about cash flow and everything, and, I know the community's been hearing a lot about the new hospital that you guys, Mineral Community planned on building in the land up here, and, we had to, went through this big rigmarole about our chamber sign, it needed to be moved, and now you're talking about building a clinic at in Alberton, and you've got, you built a clinic at St. Regis, and, so what are your plans? I mean, are you still planning on building a new hospital?
Good question.
Are you still planning on
Well, on the
building a
hospital side,
clinic in
no,
Alberton?
it ain't gonna happen. I mean, not now. I mean, you need a new hospital. When I was in Malta, it took us 9 years to get a new hospital built.
But you know what we need? We need another assisted living. We're
Right,
a
I agree.
senior community,
I agree.
instead of building us a brand new hospital, then, a lot of our revenue comes from the emergency room. Build a new emergency room, take care of the nursing residents, the nursing home people that we have there right now.
take care of them, do your emergency, or your emergency room, make it, one of the best ones. I mean, we're supposedly the
Number one.
number one in the state of Montana or whatever, but we're a senior community. And, we don't have enough housing, and there's a lot of seniors in the community that I think, that's what we need to be looking at.
Yeah, I agree 100%. You're right on target, right on the spot. It was a very unusual decision to move forward with a capital campaign like the community did with the hospital. I've never seen it done like that. And then also the investment in plans for a new hospital. A considerable amount of money was spent on architectural plans before the funding was secured. Well, the funding didn't happen. I mean, you all know that. And it can't happen right now. I mean, it's just not going to happen. John Updike came to this community with the commitment that he was brought on to be here because of the new hospital being built. And it's not happening. I mean, that certainly is not happening.
Maybe you should tell the public that.
The
public thinks it's your.
I am right now, I guess.
That's what's
Put it in
happening.
the paper.
Yes,
Say,
yes.
we are not gonna build it at this time.
Oh,
Because
no.
the public thinks you're gonna, and they're upset about it.
Yeah, well, I
So
don't
put it in the
think-
paper.
You gotta wipe out yesterday's history.
That's right.
Right. We're gonna get everything back on the right track.
And we're brand new, starting over.
Right.
And there's a lot of trust in the community that has, a
All those
lot of,
things are difficult on the community.
they did, you bring new administrators in, and you want to believe in them, and you want to believe everything that they say and everything that they're doing. And, the community has known for how long, that what they were doing was way bigger than what we were capable of.
But people weren't here.
Sure.
Yeah, but and if you don't, you need to be more open. It can't be a secret.
Right.
And that's what it's been.
Well, you're not gonna
couldn't
get
get
that
a
from
word,
Cindy.
you couldn't find out anything. Everything was a secret. Everything was behind closed doors.
We
And
understand it's
like he
horrible.
says, people
Yeah.
think that there's gonna be a hospital up here.
Can't do that.
Yeah. So I'm just gonna address the clinic in Alberton that you brought up. So at this point in time, here's what I know. They received some money to build a school-based clinic, and the money, you can only use it for capital. There is not a dime in there to turn the lights on. Okay, it seems absolutely unethical to me to go forward with that. But we started a discussion in Alberton today. If we will work with what we have to look at what you just finished saying. This is a county of less than 4,000, right around 4,000 people in a 65-mile ribbon of beauty. Absolute beauty.
85% federally owned.
Yes, we had that discussion. And the majority of people that live here, as in all rural areas of the United States, we're older. I am not in my 20s anymore. We're older. And so what do we need here for health services? If I'm in Alberton, literally, folks, there is no one that doesn't go shopping in Missoula that lives in Alberton.
Exactly.
I mean, I'm like, it's 24 miles away, for the love of heaven. Go. Good for you. I mean, there's nothing wrong with that. So what size of, one of you, I think you just said it, what do we really need here? Well, we need assisted living, long-term care, a nice, functional, state-of-the-art, how do we take care of a trauma and get you to Missoula, because you're not going to stay here with your head cut off. We're sending you to Seattle. And how do you have a really good primary care clinic here, but you can't have 14 doctors here? I mean, we only have 4,000 people. That's our job with you to listen to say, and the board. I mean, these boards are, I almost fell over when I first met the clinic board. They had been working night and day. The engagement of the community and of the board members taking their responsibility literally to the mat. It is not fun being a volunteer or a public elected board member to have to do what they just got done doing. And they did it faster than almost any board I've seen in the state of Montana.
And you know what? They have to be applauded too, because
I
there has been other boards that people have gone to with other problems in the past, and the boards they've ignored you, they've, Yeah, I mean, they did, I think, what the community had hoped that they would do, so.
That's good.
I'm Jim Morton with the Human Resource Council, and one of the things that we do is work with a lot of low-income and moderate-income folks, and additionally have quite a few rentals up and down this beautiful corridor. And one of the things that we've heard on the clinic side is that if people make an appointment for a particular issue, they can't see the medical provider for anything else, which I understand, but what's being said in the community is that even if I'm a diabetic and I have a terrible problem with my diabetes and I made an appointment for the sniffles, I can't be seen for my life-threatening problem. So my staff have trying to been saying, no, that's probably not true. And I know you guys will tell me that's not true, but how do we together start to educate the community again that the clinic really is interested in a holistic health, and that if you have a life-threatening problem, you're going to see a medical provider. But that's not what's being said in the community.
And I understand some of that happened, and it is, I hear lots of what you just said. And Regina and I have been working, this poor woman's been working overtime too, about saying, oh, heaven's sakes, how hard can we make it to let people get into our clinic? We've done a pretty good job making it pretty darn hard, right?
Exactly.
Well, it's like, okay, it's a new day, and why are we here? We are here for every patient, and guess what else we're here for as an FQHC, Federally Qualified Community Health Center? We are here primarily to take away the barriers for anyone who's low income and or has other barriers to healthcare, such as a mental illness, disability, whatever it's been. So that message was not being delivered very effectively from leadership, okay? So it's a new day, and we are every minute delivering that message time and time again. And literally, as we unwrap the big picture and try to get a hold of that, Regina and I at the little tiny level are unwrapping it minute by minute with every single small numbers of staff members to say, it's a new day, this is what we're here for. Is this the place for you? We hope so, but this is what we do here. I don't know what you used to do here.
So
I'm not saying good or bad, but it's a new day.
Yeah, right? We have about 65 rental units in the community, and certainly we'd be willing to help get that message out, because it's a barrier, I think, to people's health.
Right.
And then
absolutely.
Just want to applaud the leadership of the boards. One of the things that we were doing is working in Ravalli County, as I was mentioning to Cindy earlier, and so she's actually somebody that board members of a clinic there would call when she was at the Butte Community Health Center, and she was, you know, really a great advocate. But we had put in a grant for Community Health Center from Ravalli County, same time Mineral County did. Mineral County got more points, and you got that grant. Part of it is because you have that board structure that you do. So I just want to say that the leadership here has been outstanding. Ravalli County has 50,000 people. No health clinic, no community health clinic there. Mineral County has one. And it's a wonderful, wonderful service, and it's something for all of us to be proud about. And that's why it disturbs me when there's people in the community who have been misinformed. And so, at Human Resource Council, our staff and folks are ready to help you get that education thing going again, because what you have is very unique here. And as you know from being in the business, this is an incredibly unique situation here, and you are a leader in some ways.
Yeah, that's why we have two interim CEOs. You know, probably some of you are wondering, well, why are two? Is I don't know squat about federally qualified health centers. You know, I know the traditional model in a small town is like I had up in Malta. I mean, we had a clinic, but it was a federally certified rural health clinic. You know, hung on to a critical access hospital with some assisted living beds and some long-term care beds. So I would not have come here, you know, to take on the challenges, of which there are many, in Superior, if Cindy had not been here. If someone like Cindy, especially Cindy, had not been here, because she is the expert in the area, you know, certainly on FQHC. I don't know if you know it, but she also helped Steve Bullock, with the She's a good one. She's a good one.
Too much.
She really is.
I mean, go ahead, because it's
Okay,
about the
I have
community.
another,
Right, it
I
is.
have another question for you. About, what was it, 3 or 4 months ago, our hospital guild, when we were part of the hospital, we were doing a medication assistance. Because we had people in the community who could not afford their medication, they couldn't afford the
Co-pays.
yeah, the co-pays or anything, and this was last December, because it was during the Christmas program. Anyway, we were sitting there visiting, and one of the new board members heard us talking about this in-service that we were gonna be doing for the community, and she says, well, we have like a $200,000 grant that's for medication assistance. And she says, why don't you talk to somebody and, see what you can find out about it? Was it you, Lonnie, that I emailed? I emailed, I was pissed. I emailed Monty and I said, okay, so tell me what's going on, because here, we're bringing St. Pat's in, so that she can tell us about medication assistance and help these people in our community who need the help. And why is it that you have a $200,000 grant that you're sitting on here and nobody in the community knows anything about it? Beth Price, who works for the Area 6...
So we don't have that. Do you
But
know that?
well, now let me finish. So Beth Price, who works for the Area 6 Council on Aging,
Right.
she
We just were with her.
called, and on the night of our meeting, I got an email from Holly. And Holly said, yes, that you do have a $200,000 or $250,000 grant that is for medication assistance, and that they just haven't got it off the ground yet, but, in the next couple months, we'll be hearing something about it. We've never heard a word. Beth has never heard a word.
We don't have that. So, one of the things that happened, and you know that more than I'm giving you the bird's eye view from someone who walked in after
3
you
weeks
took care of the hard stuff. You already took care of the hard stuff. So I came in and they were so misled about things when they became an FQHC that people, in the kindness of their heart, were saying things that aren't true. So what we got, I have all the records, and I will go back and make sure there's not something hidden, because I am learning something new every day. Okay, so I am just telling you, Monty, if there's 200,000 somewhere, I'm not going to be happy that we...
And I have an email.
Okay. Here's what happened. We were allocated to become an FQHC. So Larry just told you about rural health clinics. So the difference between, in simplified terms, this would be a couple-hour discussion, but rural health clinics came about so that they could get a certain rate on Medicare and Medicaid, so they could stay open in rural places, just like tiny hospitals called critical access hospitals.
Which we are here.
Yes, we are here, and in lots of places. There's only about 10 hospitals in Montana that aren't. Almost all were, okay, and the issue behind that is, how do you stay open when there is hardly any people in our county? How do we do that? Well, Bacchus specifically, who's been around, helped at the federal level getting reimbursement rates to keep those two things open. FQHCs, federally qualified health centers, are in some other small towns just like this. I happen to have run some in some other towns. Here's the difference. Now you get a grant that allows you to offset some of the uninsured costs. Because until January 1, many people in our country, especially Montana, did not have health insurance. Not because they didn't want it,
20%.
but because they couldn't afford it, right? We don't make very much money in Montana. We live fine. Some of us. Some of us have a hard time, but we live fine. We don't make much money. So it says, we will make sure that people who are on low income have access to health care. And in doing that, the feds say, show us the need, we show you the poverty, and that there's nothing happening here. We don't really know how it happened. I fell off my chair, just like Jim, when Mineral County got the FQHC grant.
Yeah, so
Fell
did the CAHs around the state.
So, but you got it, and so you say, hooray for you, it's a gamble, you guys won, way to go. So what that means is that when you open your doors, we opened our doors 10/6/12. That is the official opening date of an FQHC here. You happen to have been a different color on 10.5, and you turned a different color on 10.6. So you went from a blue rural health clinic, it's a nice color, and now you became an FQHC turquoise. But what you got is a grant. So how your people interpreted this is they're saying things, we have a bunch of money, we can do Medicaid assistance. That isn't what the grant says. The grant says you have this amount of money to make sure healthcare is delivered, and in fact, the big things we're not doing like we should be, but now we're in a financial crisis, so it's going to take us a while to get there, is we're not doing the kind of oral health services we're supposed to be doing. As public health, first person I talked to when I was here, though I haven't gotten to see her since, because I've been buried, is we're not doing our oral health work, and we're not doing our integrated behavioral health work, right? And we're not taking on the patient assistance work that we could have from day one, nor are we taking on the malpractice issue that we could have taken to minimize our costs. There's a lot of things that got swirled around in that leadership issue going on. These were good people. In their heart, these were good people. But at a leadership level, they were taking on a lot of things that they got, within 3 months, they won the jackpot in 3 different categories. I mean, I was in DC the day the innovation grants was announced out here, and I called everyone I knew here to go, did you know about this? And they go, no, we don't even know what's going on. People were dumbfounded, but again, you won the jackpot. So we're there. We took care of last year. We're there. We're stable. We're stabilizing. We're going to go forward. So medication assistance, there is not a separate grant. We have 340B access, which is access to pharmaceuticals that are cheaper than full pay, that we have not opened up yet. I just read the email again today to work with the local pharmacy. That still will not get rid of the need for medication assistance. We used to run big medication assistance programs in Dillon, Montana, Sheridan, Montana, and Butte, Montana. Even with our grant, we'll need assistance. You know it's the biggest burden we have with most people, right? How do I pay for my meds? So I'm sorry you were given misinformation, but there is not 200,000 stashed somewhere for that. We don't have it. What should have happened is they should have said, is that a concern of yours? It's a concern of ours. How do we do this together to maximize that no one falls through the cracks in our community, right? You guys were on it. We just didn't, somehow that connection didn't happen in the right way. And, you know, I'll apologize for the sins of the forefathers, but we got to start and get to it.
Yeah, just another quick comment about, grants and stuff. I ran a project for the Hospital Association for 20 months, about 3 years ago, that worked with real small critical access hospitals. It took us several years of working with the feds to come up with this small amount of money to kind of develop a new model. Well, number one, you never ever want to get involved with a grant like that unless you know that it fits. Unless you know that it fits. And I can't remember where I was when I heard that Superior got this FQHC grant and the CMMI grant and stuff, but I was equally as dumbfounded, and my first thought was, that, especially the innovation grant, I mean, it's going along, it's doing its thing, it's a very, it's doing what it needs to do, certainly, but it really doesn't fit very well in a community of this size for a guy who's been hanging around small rural hospitals for 32 years. It just didn't fit right. And, I think the community is a victim of that. All we can do at this point is just move forward. Move forward.
What about that? I read in the paper $130,000 of misappropriated grant money. Where's that coming from?
So here's
The
what that
vehicle
means.
and salaries.
So let me tell you what that means in the world of grants. First of all, it wasn't misspent, okay? Meaning, this board, they sit on it, we have paid all those costs. What it means is that those costs, when it was used for this specific grant, called the Innovation Grant, was not allowed in the scope of that grant. But in the organization, we took care of it over here. The car, the Subaru, just so everyone's first public, do you mind if I say this, board? The Subaru is for sale. It is $24,000. It was $31,000 when it was bought, and it is a nice Subaru. I have the exact same one, only not as cool.
Will you take 15?
24 is a good price, and I think we can sell
get her.
Oh, we'll talk then.
So misappropriate means
Bird to hand.
I know, they weren't
Yes.
supposed to purchase things out of
For
that.
that innovation. But it did not, it's not wandering around and we took it out of John's pocket to pay for it, right? In our big organization.
Nothing
but-
illegal was
No.
done, you know.
So we have
It's just misallocated.
we took care of it.
Misallocated.
Are we happy to have done that? Not really.
Yeah.
But we took care of it. We're fine. We're fine. And I have to tell you, the people working in the CMMI grant, which is Center for Medicaid and Medicare Innovations, are incredibly committed and are working their little tails off. I am very involved with what's going on in oversight of that grant. We have lots of oversight, and John, in fact, as a board member, has been involved in it a lot. But I was a little skeptical because I knew a lot about it from outside, and when I came in, I'm quite impressed with the caliber of people working on that, and we are driving that, and the feds are with us. So we are so in sync with what the parameters are now. And remember, it's 3 years. It will be gone. There will be nothing left of that. It's an experiment.
Years ago, when we would apply for grants over at the county, you know, if you might not never get another grant. If
Right.
You know, it was,
Well, these are brand new in the United States. That's why that's why most of us were watching it and fell over when Montana got two.
Right.
They got one in Superior, one out of Billings. It was based out of California. Anyway, you know, it just kind of blew all of us out of the water. So these won't continue on. I mean, they're just an experiment from Centers for Medicare and Medicaid. So that's where that went.
Okay, so I have another question. So the van is
What is
gone-
the van?
The van,
The bus?
the bus.
Okay.
The bus is gone as of Thursday, right?
It is.
So
It is.
will you be applying for, I mean.
We'll apply for another one, but to be used only for patient transport, you know, at the nursing home.
A smaller
will it
bus,
require a
smaller bus.
CDL license?
No,
No.
no.
Only if you have one, Shirley. Only if you have one. We're gonna get you there.
Yeah, actually Madeline and I are the ones that got the hospital bus that you have right now. So,
The first one.
the first one, the
Yeah.
one that's got, that we've got through,
Does it have 200,000 miles on it?
it's got over 200.
So just so that you that are interested, there is gonna be a transportation meeting to talk specifically about what are the real needs, which will be on Tuesday before
26.
Thanksgiving. Because
John.
it's an issue everywhere, right?
Oh, man, that thing drives by my house, I don't know how many times a day, and it is empty.
All right.
Well, it stops now.
You know, I've only been here three weeks, but on the last board report, you know, Monty put a little board blurb in, you know, for the hospital board, and, you know, and you did some, you know, promotion of the imaging and, you know, the mammography, the new mammography machine, and it was going down to St. Regis and DeBorge, I think, to, you know, pick up people, and, you know, went down there a couple, 3 times a week for a little while, and Monty, you know, summed it up very nicely. No takers. No takers.
Albertans never used it.
So, you know, faced with that, that was one of the first things certainly that we looked at on the hospital side. We were hemorrhaging cash, and, you know, John Updike actually ran the numbers for us, and we were losing $2,683 a month, right, John? I think, do I have the number right?
Yeah,
Pretty
that's
close.
right. That's right.
My old ball brain works some
Yes.
things. You know, so, you know, and the other thing that made us feel a little bit better about that was that the bus driver already had
Open his own new business.
he had seen the handwriting on the wall, I think, and he already has other plans for other employment with his cleaning business, so.
I'm on Buckle Up Montana committee. We put in 2 child seats in that bus. They're worth about $75 a piece. And
Get them out.
So John,
can we get them out?
Yeah,
Mike?
yeah.
Let's get him out.
All right.
That and the radio.
Yeah, discuss that with Julie today, Julie's.
Thank you.
great.
Good.
Sir?
Yeah, I have a question for you, Cindy. Back to the clinic. You wanted the trust of the community, and just an example, last year, I get these colds anyway, but I have to go in and get a Z-Pack because they go into my lungs, and I seen 2 of your, 1 physician assistant, 1 doctor, $132, which is fine. They went over quite. Then this year, I just went here a couple, 3 weeks ago, and it cost me $241, and they didn't even turn on the computer. to see my records.
Did you call me?
No, I went over billing and they said they'd look at it and I got another bill for the exact same thing.
You need to, would you please put your name and number so I can get ahold of you? Take care of that. So what's happening in billing is, we went to a billing service. I'm not gonna keep that billing service. I'm gonna break things so that I can take care of that with our employees, like that. And now, that's gonna take us a little bit of time here, but that's one of our plans. It's very difficult, from my point of view, and the board would have to jump in, but it's in our preliminary plan. Lloyd's seen it the most, and Bill, about getting that back in-house so that the jobs stay here, number one, and that the training stays here, and so that when we get a customer telling us something that we did wrong, because we will continue to do some things wrong, but we better not be doing it at the rate we're doing it now, right? We'd like to be perfect, but, I'm too old. We're not going to get there, but we're going to get way better. So when I get a call from you on something, I don't have to then, chase it. I want to be able to take care of it right away. I now can do that. That's one of the first things I can do that. I can make sure that happens. But once those jobs are back in our little clinic, it'll be even easier. But give me your name and number. This will get taken care of tomorrow. Or how about someone who hasn't?
On a positive note, please,
That's
Sorry.
okay, go ahead.
on a positive note, 6 months ago, I needed my blood pressure medicine renewed, and a well checkup. And it took me over 3 weeks to get an appointment. A week ago, or 2 weeks ago, I guess it was now, I called on a Wednesday, and I got an appointment on Friday.
Oh, thank you.
Not only that, the next day, on a Saturday, I got a follow-up call that wanted to know how my appointment
Yes, we have instituted that.
Very good.
Cindy's been talking about
I
that.
was very pleased with that.
Okay.
That somebody cared
Yes.
enough, wanted to know if I was taking my blood pressure, wanted to know if I was logging it.
Whoa.
Do it right and do it one better.
One thing, if I can pipe up and say something, is it took a long time for the processes to get where they're at. It's going to take time to build those back up. I've been working diligently since I've been here. It feels like I've been here like 5 years, but it hasn't.
Cindy's
been
been
about-
here 2 or 3.
Yeah, it's been about 7 months. So, the hope is that we can continue to build our processes, give better timely service, great quality care. And when you come in for your sore throat, we're probably going to check you for your prostate also.
Bend over.
At some point, we are...
Only an RA. That's good.
We're currently working on, building some processes that you guys will start seeing where you're gonna have nurses calling you before your appointment, so that we can make sure all of your needs are met. Make sure that we're seeing you for all the things we need to see you at that appointment, and we have all the tools to see you when you get there. So you guys are gonna start seeing that. Again, we won't be perfect at that for quite some time. It's gonna take a lot of time. We're in baby steps. So, I'm hoping we can get to the point with the community that we earn back some trust. You guys are seeing the quality care you want to see. Rome wasn't built in a day. It took a long time for it to get to the point where it's broken to the point it was broken to. And it takes a while to build those back up. So, my assurance, I know that's my job and that's what
I feel real comfortable coming in to see you because I don't have a prostate. Mine's already been removed.
Find something else.
I just want to make a comment, and I'm sorry, my voice is kind of hoarse. I've been the public health director here for 17 years, and this is the first time I've been really encouraged about the changes I've been seeing. And we've been working closely with Regina and making some associations and collaboration on efforts on immunizations and other areas, but I have never been more encouraged than I have in the 17 years. And then along comes Cindy, and the first thing she does is come into my office and raise havoc,
Oh, we were joyous. I'm so happy.
It's very encouraging, and I want you all to know that what I see by these 2 grants, and you guys might not see it, as a blessing to this community and an opportunity to do some really good things. So please, I know how it works here. Word of mouth is your best tool of advertisement. Get the word out, people, and let them know. We cannot afford to lose this hospital or clinic. It will be devastating to our community. It just will. So get the word out and let them know that good things are happening there. I see it.
I've heard this before, we hope.
No,
From one of the hospital district board members.
And I think there was a question down there, or a hand. Did you, anyone down there? No? Okay, ready?
I have lost, well, the clinic has lost records of when they've never been able to locate them.
Great. When did that happen?
Well, it was 2 years ago,
Oh, okay.
December, and they've lost a whole, like, years, not the whole file, but like the last year's file, a chunk of it, that I keep going back and asking, did you find it, have you found it? And then still with me with billing, and, because I've had numerous.
Would you make sure the billing issue's down there, and I don't know if I can do anything with records that are 2 years past, being lost. And I, again, apologize for the sins of the forerunners here. That would just be very discouraging.
They don't keep, I never understood how can you just lose
They
something
can't,
like that.
well, trust me, I've worked in paper charts for many, many years, and, if you worked in paper charts, you'd go, how in God's name do we keep them? I mean, it's just such a wreck. No matter if you have the best medical records to keep on the face here. Now, of course, as we change to electronic, there's problems on that side too, but the whole reason is not to lose them, right? So, but, it would be devastating to lose historical medical records. Maybe if in the next year we redesign the clinic again, we might find them, but don't want to hold out any hope there. That's
So
pretty
then
long time.
also, meetings, you said you had the transportation, is that a daytime meeting?
It's 9 o'clock Tuesday, the 26th.